Can lifestyle, health, and proper exercise be helpful in recovery?
So it is said that nearly 30 to 40% of all types of cancers are related to lifestyle and, our food habits, exercise, physical activity. So obviously changing those once you've already had a cancer diagnosis goes a long way in recovery. It is said that in breast cancer, for certain subvariants of breast cancer, a lot of studies have been done, after completion of treatment, what can help prevent recurrence. And few of the things which have been studied, multiple things have been studied, and few of the things that have been proven to prevent, to decrease the risk of, relapse from breast cancer is maintaining your body weight or reducing your body weight to your normal, which is normal for your height. Also physical activity and exercise. It is said that nearly 30 to 40 minutes of physical activity, at least 5 days a week, cutting down on obesity, eating healthy can go a long way in, decreasing the risk of relapse. So yes, lifestyle changes, dietary modifications, increasing in, physical, increase in physical activity can decrease the risk of relapse following a breast cancer.
What kind of clothes can I wear after my recovery?
So I think there is no prohibitions when it comes to clothing with relation to breast cancer. It is just that post-treatment, post-surgery, post-radiation therapy especially, the breast may feel sensitive. There might be an altered sensation, especially on the breast and on the lateral side of the breast and in the armpit. So we would say, wear whatever you're comfortable with, lightweight, cotton clothes, clothes which absorb moisture, which are not too tight on the skin, leaving an impression. There's nothing that you can't wear this or you can't wear that. I would say just wear whatever you're comfortable with. People always ask questions about, the kind of bra they can wear. Can they wear a bra? Can they not wear a bra? Can they wear an underwire bra or, a padded bra? It doesn't really make a difference. It's just that immediately post-surgery and post-radiation, we would say avoid, the innerwears for some time till it's completely healed and your tissue is, not sensitive to sensitive to touch and feel. But otherwise, once you've completely recovered, you can go back to wearing whatever you're comfortable in.
Will I be able to back 100%?
I think that's a question, $1 million question. What we encourage is even during treatment, we encourage our patients to continue leading their normal lifestyles, to continue working, not to make any dramatic changes. Yes, it's a little difficult, ongoing treatment. They could have fatigue. They feel very tired. They feel, they're not up to the feeling. So at that time, they might take a little bit of more, time to recover from in between chemo sessions or post radiation feeling tired, or post surgery just having a lot of pain and maybe inability to move. But I think once you've completed treatment, all of us push for recovery to 100% because breast cancer is one of the good cancers where patients do well after treatment. They go on to lead a normal life. They have normal lifespans. So we encourage them to go back to 100% of what they were before, or I would say even more than that, because this itself is such a tough battle that they have gone through, that they emerge more positive, grateful for life, thankful for life, and learn to enjoy the small things, the small gifts in life. So I think all of them should be able to go back to 100% of what they were from before.
Can life go back to normal after breast cancer?
That's what I just said. It definitely can go back to normal. Even during treatment, we encourage people to continue working, not give up their work. Many a times people ask, can I go to work? Should I quit my work? And I always tell them, no, you should continue with whatever you've been doing from before. And, in case during the treatment, there are days you don't feel well, you feel very tired, or, you're feeling little vomiting sensation, or, just feeling just a gentle being of unwell. At that time, you take few days off, relax, rest at home. Don't push yourself where you feel very tired, take it one day at a time. But post-treatment, post-completion of treatment, people do have some lingering side effects for some time from the chemotherapy, effects of chemotherapy. But I think within 6 months to 1 year down the line, they're all back to complete normal life.
What are the treatments required after breast cancer recovery and their cost?
So breast cancer is treated in with different modalities. Most often, people undergo surgery, chemotherapy, radiation, plus or minus targeted therapy. If people they have a hormone positive variant of breast cancer, we do put them on anti-hormone therapy once they've completed that. So that involves usually taking a simple tablet every day for the next 5 to 7 years, depending on what your doctor recommends. So I think other than that tablet, which is recommended only for the hormone positive breast cancer, there's nothing else that we do once they complete the treatment. We do keep our patients on follow-up. We keep calling them back once in every 3 months for a clinical checkup. And as and when required, we might do additional tests. But these are just the routine tests like ultrasound, chest x-rays, which are not very cost prohibitive. And hormone therapy is not very expensive. Usually, I would say it costs less than 1,000 rupees a month. But yeah, after completion of treatment, most often it's just follow up unless it's hormone positive, and we put them on, anti-hormone therapy.
How do you prevent breast cancer from coming back?
I think if you could answer that question, we have, solved the mystery of, cancer. Uh, Most breast cancers do well. And I think whether the cancer comes back or not will depend on the stage at which it has been diagnosed, what kind of breast cancer it is, how aggressive it is, how has the patient responded to the treatment. A relapse depends on all of these factors. Once we've completed the ideal treatment, which is recommended for an individual, the only thing we can do maybe as a patient to decrease the risk of relapse is try to lead a normal, healthy lifestyle. Include maybe a lot more of, green leafy vegetables, include at least 5 to 6 portions of fruits and vegetables in your diet every day. Cut down on your alcohol, do not smoke, get physically active, at least do 30 to 40 minutes of physical activity or exercise 5 days a week. Get adequate sleep. I think, a lot of times we talk about nutrition, we talk about physical activity, but we never talk about sleep. And I think sleep is very, very important because sleep is the time when your body repairs itself. Lack of sleep can cause a lot of, unhealthy changes in the body. So I think the best way to prevent a relapse would be to change lifestyle, get more healthy, get more active, sleep adequately, get good restorative sleep. I think those are the only things which we can do from our side to decrease the relapse, other than, getting the correct treatment at the correct time, which is important, which is, I think, the most important thing.
Key things caregivers need to take care of for recovering family members.
I think caregivers first have to look after themselves, because we always talk about breast cancer or any cancer, the patient, the trauma the patient undergoes, the tough journey the patient undergoes during treatment, but we never talk about what happens to the caregiver. See, for the caregiver, I think, just having someone they love going through cancer is a very difficult time. For them also, it's a lot of physical and emotional trauma. And all the attention is given to the patient, and these people have to look after the patient and manage themselves too. So I think the first message to caregivers out there is first look after yourself, wear your safety vest first, look after yourself first. After that, I would say try not to be overprotective of the patient. Many a times what we do is we tend to go into the extreme, overprotect the patient and say, don't do that, don't do this, don't get up, don't exercise, don't walk around, eat this, eat that. You keep pushing them, I think. And sometimes just giving the space to the patient is important. Allowing them to continue with all their normal routine activities is important. Also, understanding when they are, when they need a break, when they need the rest, maybe able to read their body language to understand, when they need to be left alone and when they need that, company is important for caregivers. Because many a times what happens is we don't tend to share with the patient what is really happening with them unless they are involved in the, treatment process. Especially in India, that it happens and patients don't know what's happening to them. So I would say always involve the patient in the treatment process and listen to what the patient wants. There are times when they just want to be left alone. There are times when they just want to get on with life. They don't want to be asked 100 times a day, how are you feeling? How are you feeling? Are you okay? Are you okay? I think sometimes just that question itself can be, trauma inducing to the patient. So I would say give a lot of emotional support, mental support, yet at the same time give space to the patient, to go on with normal life. Allow them to, continue to do what they want to do as much as they want to do. I think that's important.
How long will hospital visits continue?
So once the cancer treatment is over, we always keep our patients on surveillance, meaning to say we keep calling them back for regular visits, for regular checkups. And this usually happens at an interval of, once in every 3 months for the first 2 to 3 years. Then we move on to once in 6 months after 3 years of completion till we reach 5 years after a treatment. Once 5 years are over, usually we call our patients back once a year. So it's not that every time they come to us, we're going to be doing tests or subjecting them to blood tests or, other scans and all that. Most often it's just a clinical examination by the treating doctor. But we do keep the patients on follow-up. Yeah.